Understanding erectile dysfunction causes, treatments, and effective solutions. Introduction to reality of erectile dysfunction. Erectile dysfunction (ED) is a common condition affecting millions of men worldwide. It is characterized by the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. Erectile dysfunction can significantly impact a man's quality of life, his intimate relationships, and his overall mental well-being. Despite being common, ED remains under-discussed due to its sensitive nature, which often leaves men without the knowledge of available treatment options. This article will discuss ED, its causes, the easiest to the most expensive treatment options, and the most effective solutions for managing the condition. What is erectile dysfunction, and why does it occur? Erectile dysfunction is a complex medical condition that can stem from a variety of causes, ranging from physiological to psychological. Physiologically, an erection is initiated by the relaxation of smooth muscles in the penis, allowing blood flow into the corpus cavernosum. This process is regulated by several bodily systems, including the cardiovascular, nervous, and endocrine systems, and requires the release of nitric oxide to dilate blood vessels. Studies have identified several major risk factors for ED, including age, cardiovascular disease, diabetes, hypertension, obesity, smoking, and lack of physical activity. Psychological factors such as anxiety, depression, and stress can also significantly contribute to erectile dysfunction. Moreover, exposure to endocrine-disrupting chemicals, ECs, and an unhealthy lifestyle have also been linked to an increase in ED cases. The prevalence of ED increases with age, affecting around 18.4% of men aged 20 and above, with a higher incidence observed in older adults. The Massachusetts Male Aging Study and other population-based research have reported that more than 50% of men aged 40 to 70 years experience varying degrees of erectile dysfunction. These statistics highlight the importance of understanding and treating ED effectively to improve men's health and quality of life. Treatment options for erectile dysfunction, from simple changes to expensive interventions. Treating erectile dysfunction depends on its underlying causes, which vary greatly from individual to individual. The options for treatment range from simple lifestyle changes to advanced surgical interventions. In this section, we will explore these options from the easiest and least invasive to the most expensive and complex. 1. Lifestyle changes, the foundation of ED treatment. Lifestyle modification is often the first step in treating ED, especially when the condition is related to modifiable risk factors such as obesity, smoking, and sedentary habits. Research has shown that adopting a healthy diet, like the Mediterranean diet, is associated with a lower risk of developing ED. The Mediterranean diet emphasizes the consumption of vegetables, fruits, nuts, legumes, whole grains, and fish while minimizing the intake of red and processed meats. Men adhering to such a diet have a lower incidence of erectile dysfunction, particularly among younger men. Physical activity is also crucial in managing ED. Regular exercise improves cardiovascular health, reduces body weight, and enhances blood flow, all of which can lead to improved erectile function. Simple activities like brisk walking, swimming, or cycling can be beneficial. Smoking cessation and limiting alcohol consumption are also strongly recommended to improve overall health and reduce ED symptoms. 2. Oral medications, phosphodiesterase type 5 PDE5 inhibitors. For many men, oral medications are the next step when lifestyle changes are not sufficient. Phosphodiesterase type 5 PDE5 inhibitors, such as sildenafil Viagra, tadalafil Cialis, and vardenafil Levitra, are among the most commonly prescribed treatments for ED. These medications work by enhancing the effects of nitric oxide, a natural chemical the body produces to relax penile muscles and increase blood flow during sexual arousal. PDE5 inhibitors are typically considered safe and effective for most men and are often the first-line pharmacological treatment for ED. However, they may not be suitable for men who take nitrates for heart conditions or have specific medical issues. Common side effects include headaches, facial flushing, nasal congestion, and dizziness. Despite their efficacy, oral medications are generally a temporary solution that must be taken prior to sexual activity. 3. Vacuum-assisted devices and penile injections. When oral medications are ineffective or contraindicated, other non-surgical treatments are available. Vacuum-assisted erectile devices are a non-invasive option that helps achieve an erection by creating negative pressure around the penis. which draws blood into the penile tissues. A constriction ring is then applied to maintain the erection during sexual intercourse. These devices are effective for many men, but can be cumbersome and may reduce spontaneity. Another alternative is the use of penile injections. Medications such as alprostadil are injected directly into the base of the penis to stimulate blood flow and induce an erection. This method is highly effective, especially for men who do not respond to oral medications, but it requires comfort with needles and proper training to minimize side effects like pain or prolonged erections. 4. Intraoral suppositories and hormone therapy. Intraoral suppositories are small pellets of medication inserted into the urethra to increase blood flow to the penis. Like injections, this method can produce reliable results but may cause some discomfort. Hormone therapy is an option for men whose ED is linked to low testosterone levels. Testosterone replacement can improve libido and erectile function in some men, but it is not a universal solution for all types of ED. 5. Penile prosthetic surgery, the most expensive and invasive treatment. For severe cases of ED that do not respond to other treatments, surgical intervention may be necessary. Penile implants are devices surgically inserted into the penis to allow men to achieve an erection. There are two main types of implants, inflatable and semi-rigid. Inflatable implants allow for more natural erections, while semi-rigid rods provide a permanent state of readiness. Penile implant surgery is generally successful and results in high satisfaction rates among men and their partners. However, it is a costly procedure, and like any surgery, carries the risk of complications such as infection and mechanical failure. This option is often considered only after all other treatment methods have been exhausted. 6. Emerging therapies, novel and experimental treatments. Recent advances in the treatment of ED have led to the development of novel therapies, some of which are still undergoing research. Shockwave therapy, for instance, is a non-invasive treatment that uses low-intensity sound waves to stimulate blood vessel growth and improve blood flow to the penis. Although promising, most studies are needed to confirm its efficacy and safety. Other experimental approaches include injections of platelet-rich plasma PRP or stem cells into the penis. These methods aim to repair or regenerate damaged tissues and improve erectile function. While initial studies have shown positive results, these treatments are still in their early stages and are not yet widely available or approved for routine use. The most effective treatment options for erectile dysfunction. Effectiveness in treating erectile dysfunction depends on individual factors, including the underlying cause of ED, the patient's health status, and their preferences. For many men, PDE5 inhibitors like sildenafil remain the most effective and convenient option for achieving satisfactory erections. These medications are easy to use, relatively affordable, and effective for most men, making them a popular first choice. However, lifestyle modifications are essential for long-term success. Improving diet, increasing physical activity, and reducing stress not only enhance erectile function, but also address other health issues that may contribute to ED. For men with underlying health conditions such as cardiovascular disease or diabetes, managing these conditions is crucial for improving ED symptoms. Penile implants, although costly and invasive, provide a permanent solution for men who have not found success with other treatments. The high satisfaction rates among patients suggest that implants are an effective last resort when other therapies fail. Emerging therapies such as shockwave treatment and stem cell therapy hold promise for the future of ED treatment, potentially offering new avenues for men who are unresponsive to existing options. Conclusion: navigating the path to better sexual health. Erectile dysfunction is a condition that affects millions of men, yet effective treatments are available for almost everyone. Understanding the causes of ED is the first step towards finding the right treatment. From lifestyle changes to oral medications, vacuum-assisted devices, injections, and even surgery, there are numerous options available. The easiest and least invasive treatments, such as dietary changes and PDE5 inhibitors, often yield significant results for many men. When these are insufficient, other interventions, including penile implants, provide a long-term solution. Future treatments like shockwave therapy and stem cell injections may offer new hope for those who struggle with ED. Regardless of the treatment path chosen, it's important for men experiencing erectile dysfunction to seek help and discuss their options with a healthcare provider. Open conversations can help break the stigma surrounding ED and empower men to regain control of their sexual health and overall well being.